It developed in the midst of my training. I came into training, my residency training, very much thinking I wanted to do a subspecialty, and then I loved a multitude of things and realized I didn't want to give any of them up. And what I loved most of all, more than any specialty, was teaching. And I felt like hospital medicine was the best way for me to get to see a little bit of everything and really still get to do the amount of teaching that I wanted to do. Think the biggest thing as hospital medicine becomes its own entity to remind medical students and residents is that you're not practicing medicine in a bubble. It's not a vacuum, and that these patients' lives will continue after the hospitalization, and making sure that everything that happens during that hospitalization, all of those messages are delivered to the practitioners who will be continuing to take care of them afterwards. I mean, I think it's an incredible privilege. It's a really fun time to get to teach a field that's so young and so new, and feel like you're get to be at the forefront of introducing medical students and residents to a field that's developing in front of their own eyes. Uh, I think as this healthcare system grows and develops and changes, I think making sure that residents and medical students really know what the field is and what opportunities it has for them as healthcare practitioners is really important.
And when I first started, the term hospitalist was really not something that most folks, especially most learners, really knew what that was. And so I think, at the very least, the concept of what hospital medicine is, and that it is a separate component within pediatrics, is that that framework is much more recognizable and understandable to folks. But within pediatrics, about 10 to 15% of our graduates do that. And I think a number of them, a growing number of them, are going into pediatric hospital medicine not only as something to do for a year or two before they find their quote unquote real career, but they're actually doing it because they see it as a sustainable long term career option. Well, I think you've already started to see hospital medicine grow significantly, not only in terms of clinical roles, but also in terms of leadership. Hospitals being named as CEOs of hospitals. And I think that sort of trend is going to continue to evolve. Now, I don't have to explain to anybody what a hospitalist is. And again, I think hospitalists have really demonstrated leadership skills, and I think that will continue to develop. I would say what I really enjoy about teaching hospital medicine is developing relationships with learners and with patients and with families in a very short period of time. And I feel like I get to know what's going on with them, what they're really worried about, and how we can help them in the context of their family. And to me, that is incredibly, incredibly rewarding. And hopefully, I'm able to express that level of enthusiasm for those kinds of relationships to the learners that we're working with. I think patients and families, especially medically savvy families, can be incredibly, incredibly valuable sources of information for learners. If, for instance, there's a patient or family who has a lot of experience with hospital systems, they can say, I had a really great experience with this physician or this hospital system, and not such a great experience with this one or that one. And here's my experience, and I'm going to teach you about it so that you can provide a better experience for your patients and families going forward. They can teach learners about clinical entities, especially if they're unusual or uncommon. They could say, my son or daughter has a very rare condition, and you probably have never seen a patient like this. Let me tell you about it. And so one of the things that I like to impart to the learners is that they can gain a whole lot of medical information from patients and families, but they can also learn how to do their job better.